G'day, it's Eric back, a naturopath, author of Candida Crusher. Thanks for checking out this video. This video is for the ladies, it's not for the guys. I've got a question here from a patient in England. This is from Jackie, and Jackie's 28 years of age. She's from Buxton in Derbyshire in England. So Jackie's asking me, Eric, how do you treat vaginal thrush? How do you get rid of a vaginal yeast infection? What's the best way to cure it? I'm sick and tired of this infection. I've had it for years. I've been to doctors for many times, and she writes here, I've taken fluconazole on and off regularly now for the past 6 years. I'm taking it monthly. It's not working. What can I do? I'm tired of this yeast infection. Well, Jackie, the best way to get rid of this infection is using a multi-stage approach, okay? You're wasting your time treating this vaginally or locally. It's a complete waste of time. You need to tackle this from 7 different angles. Like anything in life, if you want to do something, there's several ways of doing it. You can do it the quick, easy way, the lazy way, or you can do it the more convoluted way. It can sometimes be a waste of time, or you can do the intelligent way. Now I'm going to explain to you the intelligent way on how to nail a vaginal yeast infection and how to get rid of thrush completely, okay? I don't use the word cure. You won't find cure in my book. In Candida Crusher, I didn't write the word cure, okay? It's a 4-letter word. I don't like using 4-letter words that much. The cure word in my business. In natural medicine, cure is really is anathema. Anathema is a word for, it's really bad. It's just something we don't do, okay? I let doctors, medical doctors, use the word cure, okay? Because I don't really believe you can cure something entirely. You can get rid of something or inhibit it, but the best way to describe getting on top of a yeast infection is to control the infection, all right? So how are we going to control this yeast infection and tame it? Right? It's like anything in life, you need to do it intelligently. So when you've had the problem for a short period of time, I like getting patients to come down on a acute yeast infection like a ton of bricks. They immediately tackle it head on, okay? It's like anything in life. Push it hard, go for the max, get it over and done with, and then be vigilant for any signs of reoccurrence. That's the thing, okay? If you can be vigilant and understand that a yeast infection can recur at any time, and you make immediate changes, which I'm going to explain to you right now, you can nail that infection within usually a week, and you won't get it back again for several months, all right? So how do we go about eradicating a vaginal yeast infection or thrush? Well, obviously we want to look at local treatment. Now in chapter 5 of Candida Crusher, you can read a lot about the local 2-stage treatment of a vaginal yeast infection. If you go to yeastinfection.org, my comprehensive website, you can read my 2-stage vaginal approach, the build, the kill phase, and the build phase, okay? So I want you to go to that website if you haven't already gone there and use that 2-stage approach. I presented vaginal yeast infection treatment at a medical conference in Sydney last year, 2014, and it was well received by over 300 doctors. I got a huge, good response from this presentation. Many doctors came up to me after wanting to know how, I came about this treatment. How successful was it? And so many doctors told me they were disillusioned using fluconazole, and they really wanted something that was going to nail it once and forever. And I basically said to them, well, you guys need to start looking at things that you don't currently do that I do, and that's actually lifestyle changes, diet changes, and local treatment. So those are the 3 things I want you to get into your mind, Jackie. You need to look at changing the way you live, which can often mean sleeping better, eating better, relaxing more, understanding the connection between stress and impaired immune function. All of these things are written in my book, Candida Crusher. This is why the book has been so successful, because it just doesn't really tackle the problem, it tackles the cause of the problem, okay? There's always a reason why vaginal infection is there. So local treatment is not that difficult. You need to use boric acid, or you can use different types of douche treatments. You can read about that in my book, or go to my website, yeastinfection.org. I'm not going to elaborate on those today. You look at dietary treatment. You need to stop feeding Candida internally, because most women who've got a vaginal yeast infection have got an intestinal yeast infection. 20% of healthy women normally have Candida in their body, right? But I would say that 90% of women with vaginal yeast infection have got Candida in their intestinal tract, in their small bowel, in their large bowel, all right? So that needs taming. You need to really stop feeding these bugs, and you'll do that by diet. Now again, I've got a 3-stage diet. You can read about that in my book, chapter 7. is in 5 sections, and it goes into great detail, more than any other book you'll ever find, about what to eat and what not to eat. My website, yeastinfection.org, has got hundreds of articles on it relating to diet. So go there and read about what to eat and what not to eat, all right? And the third, but most important in my opinion, is the lifestyle change. You need to understand the connection between the adrenal and thyroid function, impaired immunity, and why you keep getting this thing back again. Now, I've treated thousands of women for vaginal infection, thousands of them. You name the occupation, and I can tell you, yep, I've had a patient with that occupation with a vaginal infection. Recently, I've been treating several women from the US who work with airplanes, like air hostesses. I've had several of them now. Now, they work crazy hours. They work shift, weird hours. They fly to strange destinations and eat all kinds of crappy food. They're under high stress. They've got impaired immunity because of lack of quality sleep. They're eating the wrong kind of food. They're drinking cheap booze. Many of them got crappy relationships because they're away from their partners. Is it any wonder they got these vaginal infections? They've got to wear pantyhose, you know. Several cases, I've said to these women, you need to get rid of your job for 6 months. Let's get rid of this infection and then reapply. And let's first get you to do some local flying in northern US before you branch out and go to Europe or, intercontinental. And for some women, it's made a massive difference. So you need to tackle the lifestyle, okay? Are you a young woman with several children under high stress? Are you separated or divorced? Are you under a lot of financial stress? Have you got a poor relationship with your partner? These are all things that I want to know if you're my patient, because these things mean a lot to me, because they could be impediments to curing your thrush or vaginal infection. If you're serious about getting rid of the infection, you want to look at the causes of the infection, not treat the manifestations or the outcomes of why you got this in the first place. Did you take an antibiotic routinely? You know what I mean? Look at these sort of things. If you can nail this, the infection's gone. All right, it's as simple as that. So Jackie, I hope that's answered your question today. Thanks for tuning in.